With Robert Palmer, Managing Partner, SUDLER Hennessessy Digital, and he gave a presentation today at ePharma Summit. I thought he could tell us a little bit about his presentation.
Well, thanks. Just a real quick download on the presentation. It's about the three-way conversation that takes place between patients, physicians, and payers, or managed care, and how the brand can insert itself in that conversation. Talked about the problems with communicating with the patient. They're pretty much one-way communications where the brand can impart information, but there's not a real chance for a dialogue. It drives the patient to the physician, and then with the physician, generally speaking, the brand has a pretty one-way conversation with the physician as well, although less so than with the patient. And then there's the natural roadblocks and barriers between the patient and the physician. The patient takes a very emotional tact towards his or her condition. The physician is very controlled, very scientific and data-driven, so there's that natural barrier. They talk a different language most of the time, but they do have the same goals. And then the third leg of the stool is managed care, which increasingly is interfering with therapy in that drugs simply aren't being paid for, especially new drugs that are introduced in a crowded category, and also the breakdown between the patient's knowledge of his or her coverage, the physician's knowledge of that coverage, and how that drives the office dynamics.
Thank you very much. Appreciate it.
Thank you.
Trying to get their normalcy, trying to get their life back, and all of the impacts of the disease on that. The physician is clinical and practical. His concern is being authoritative. He's concerned with data. He's concerned with science. And so the natural barriers are, they have different motivators, both emotional and psychological. They have a different lexicon. They're speaking a different language most of the time. And they have very different approaches to the same problem. And the communication certainly doesn't follow a straight path. The DTC efforts and other efforts are to attract the patient one way or the other. It's not a straight line between the patient going to the doctor and getting on therapy. The patient needs to be motivated. There needs to be a call to action. They need to go to the doctor. There's then the diagnosis, which is where a dialogue hopefully takes place. There's then managed care comes into the picture, where the payer makes a decision as to whether the prescription will be prescribed or filled. And then, of course, there's adherence and persistence, which is what we all worry a great deal about.